and Ms. Hicks testing positive for coronavirus. And on behalf of public health, I want to extend our sympathy and wishes for an uneventful recovery for all. I also want to recognize that each day in the US, we have 40,000 new cases and 700 deaths from COVID-19. In King County, we've had over 22,000 cases and over 750 deaths so far in this outbreak. This is an unacceptable amount of suffering, and it doesn't have to be this way. And I'll talk more about that in a few minutes. Now I'd like to update you on some of our local trends. After a decreasing trend in the number of cases since late July, transmission and cases are increasing over the past 2 weeks. As of this morning, we've had 22,560 cases, 2,378 hospitalizations, and 758 deaths in King County. This is unacceptable. We're now having about 119 cases reported each day over the past week, which is up 40% from the prior week. Our countywide positivity rate is also increasing over the past 2 weeks, from approximately 2% to around 3%, which represents increased transmission. We expect our corresponding incidence rate to increase as well, up from the 53 per 100,000 over 14 days that we saw last week. Hospitalizations were down in mid-August through mid-September, and the trend remains low, but we did see an increase the week of September 20th with 26 hospitalizations compared to what we saw the week of September 13th with 13 hospitalizations, and we'll watch this closely. Our deaths remain stable and low. There were 4 the week of September 20th, and I'm very happy to say we had no deaths reported last week. The median age remains 80 years. Approximately 40% of our cases are in adults under 30 years of age, and 60% of our cases are in adults under 40 years of age. But we are seeing cases increasing in working age adults and older adults as well. And we continue to see the previously described health disparities from COVID-19 disproportionately impacting communities of color, particularly in South King County along the I-5 corridor. But whites have accounted for almost half of the recent cases in the past week. King County is continuing to increase the number of COVID-19 testing locations that are open to all, and we're adding more sites in South King County. Testing is now available in Renton and Auburn, and a new testing site will open on Tuesday in Tukwila and one in Federal Way the following week. And you can check our testing webpage for details on these sites. I'd now like to share a few updates about one of our recent outbreaks in the community, the large outbreak of cases within the UW Greek community. We are aware of over 100 confirmed COVID-19 cases among 9 fraternity and sorority organizations. And the case counts have increased rapidly over the last several days, and we expect additional cases to be reported. None have been hospitalized. Young people are no less susceptible to getting COVID-19, and we're seeing how quickly cases can spread in congregate living settings, which present a real challenge for COVID-19 prevention. We've been working closely with the university's environmental health and safety team and university leadership to provide information, recommendations, and guidance to the affected fraternities, sororities, and the university community to help contain the outbreak. And we're working also with the fraternity and sorority organization leadership directly, who are being cooperative and understand the importance of addressing this issue very seriously. We're providing guidance on isolation and quarantine in the shared housing facilities, as well as other steps to prevent COVID transmission, such as cleaning and disinfecting of high-touch surfaces, face covering compliance, halting non-essential visitors, and increasing ventilation. The university is providing surge COVID-19 testing on campus within walking distance of the Greek houses, and they plan to offer testing to all members of the Greek system over the next few days. As for students living in communal houses, it's critical to wear face coverings if you're in any common spaces outside of your bedroom, and to limit gatherings, and to keep 6 feet of distance from others. This will be so important as we move indoors with cooler weather on the way. And I'd like to say a little bit more about this in general for all of our community. The trends we're seeing today should be a wake-up call for all of us. We need to come together as a community and increase our resolve to protect one another. As we head into fall and winter, we need to prepare and will face an increasing challenge from COVID-19, and the potential for a significantly larger outbreak than we've yet seen is real, but it's not inevitable. Much is in our control, and our actions can determine the course of the outbreak. Returning to schools, increasing indoor activities, and socializing in the community, closing windows and doors with the cooler weather, and environmental conditions can all increase the risk for COVID-19 transmission. It's critical to remember that we know what works, and we know how to reduce our risk and prevent the spread of COVID-19 to others. We need to act on with our knowledge. Mask use is especially important indoors when outside the home, even if 6 feet of distance can be maintained. Avoid crowded indoor settings, limit the duration of contact with others and the number of activities outside the home. And hand washing and sanitizing remains important, along with regular cleaning of frequently touched surfaces. I also want to add that as we head into fall, it's important to remember that we have influenza season looming as well. And although it's impossible to predict the onset and the severity of an influenza season in advance, the prospect of even a mild or typical influenza season compounding a COVID-19 outbreak is not a very happy thought. It's potentially a rather challenging and let me say this again. The combination of even an average influenza season the possibility of even an average influenza season compounding the COVID-19 outbreak is potentially a huge threat to our healthcare system and to our community. By using a safe and available vaccine, we can both protect ourselves from developing influenza disease, hospitalization, and for those of us who are vulnerable, death, but also developing an illness that can be confused with COVID-19 and needing to be isolated and tested for COVID-19, and also exacerbating the load on our healthcare system, which will be very much strained with caring for COVID-19 patients and others who need to seek healthcare for other purposes. So influenza vaccine, safe, effective, and is incredibly important this season. So please take advantage of it. With that, I'd like to conclude my prepared comments and happy to take your questions.
Great, thanks, Dr. Duchin. Looks like we do have a few questions in the queue already. Again, we would ask that you ask a question, have Dr. Duchin answer it. If you have a follow-up question, we'll try to get back to those after others have been able to ask at least their first question. Let's start with Nick Popham. Nick, you are unmuted.
Awesome. Can you guys hear me?
Yes.
Yes.
Great. Thanks so much, Dr. Duchin, for this. This is Nick Popham, Como TV. My first question, and the question I guess to ask for me is, will we learn anything with contact tracing, the president testing positive, and how important is contact tracing right now in the wake of the president testing positive and more cases on the rise?
Thanks, Nick. Contact tracing remains a fundamental tool to help us manage this outbreak. Of course, the more cases we have, the more difficult contact tracing becomes, both because of the volume of cases that need to have their contacts traced. Each case has multiple contacts typically, and also because with many cases and much transmission occurring in the community, contact tracing is less effective, relatively speaking. So it's most effective when we have fewer cases. We're doing well in King County. Prior to our recent uptick in cases, our team was able to trace all the contacts of the cases that were occurring over the past couple of weeks, but the recent increase is going to make that difficult. What we learned from contact tracing basically is that many of our cases are secondary to other cases in the household. We interview the cases and the contacts, and we learn about risks for transmission and where people are, the types of activities people are doing that predispose them to COVID-19. We can't always say with certainty where someone was infected, but we can say that there are a large proportion of cases that are infected from household members, from activities in the community, including workplace, including social activities. The Greek outbreak is one example, but there are many other activities in the community that people are doing. They're socializing with friends and family. There are cases associated with faith-based institutions, indoor worship. There are cases associated with a wide variety of different activities, including travel and so on. So the main purpose of contact tracing, though, is to both help us identify where transmission is occurring and to have people who are exposed but not yet ill quarantine themselves so that they don't spread the illness to others, and to test those people so that if they're infected, they can be isolated and, again, their contacts traced sequentially. So contact tracing remains important, and it remains challenging, but it does provide valuable information both to people who've been exposed to COVID-19 and to our public health system.
Great. Thanks very much for the question, Nick. Next up, we have Dee Dee Sun. Dee Dee, you should be unmuted.
Hi, Dr. Duchin. Yeah, my question is, you mentioned the test sites that are opening up in South King County. We know that the Department of Health will soon be distributing the rapid tests that the federal government is getting. We're expecting about 1 million of them in our state. And can you talk a little bit about the rapid test versus the PCR test, and will any of our new test facilities be getting the rapid test?
Thanks, Dee Dee. Great question. So the federal government is distributing a lot of point of care rapid antigen test kits. And these have potential value. Unfortunately, what we don't have to go along with the kits is guidance on how to use them. We don't have guidance from the CDC or from any other public health agency or medical professional association. And in particular, we don't have guidance on how to use them for screening people who are asymptomatic. Nonetheless, they may turn out to be valuable in that setting, but we just don't have a lot of evidence and experience to know how they perform and what the best strategies are. We are using PCR testing at our community-based testing sites. It is considered to be the gold standard. And I do know that over time, many feel that we will be having more and more point of care tests out there. And I think that's probably a good thing, because the quicker people are diagnosed and isolated, the more we can interrupt transmission. There are lots of challenges associated with these rapid tests. The way they work and how reliable the results are depends on how likely the person tested is to have COVID-19. So in populations that are highly likely to have COVID-19, for example, in an outbreak setting and where people are symptomatic, a positive test is relatively reliable. But in screening with people who have no symptoms or are not known to be exposed, a positive test has a high likelihood of being a false positive test and needs to be confirmed with a PCR test. So I think in a nutshell, the answer to your question is, I think there will be a role for rapid testing. We don't have a lot of guidance and evidence on which to base recommendations for how they should be used currently. We are in the process of considering how to do that. The state is also working on guidelines for using rapid tests. There are a few instances where they're being used in long-term care facilities for screening. But at this point, I think we're not ready to roll that out in the community on a wide scale basis, either at our testing sites or for screening, possibly in selected locations to learn more about how they perform in various settings. If people are sick, when they go to a healthcare provider, they typically get a PCR test. And that's the standard test that we're using in our testing sites for the foreseeable future.
Great, thanks. Next up, we have Anna Boyko-Wyrock. Anna,
hey,
you
Jeff.
should. There we go.
Oh,
Anna.
hi there. So my question is around the Greek system outbreak. Could you walk us through the trajectory of this outbreak, I guess, initial source, how it spread? But then my biggest question is the denominator of how many people were actually tested to find the cases that did come back positive. What was the overall scope of testing there?
Yeah, Anna, I can give you what I have off the top of my head here, but if for full details, we'll probably want to get back to us, and we can summarize from the actual investigation documents. But I can tell you that as of last week, the university was performing a screening of returning students and had identified very few cases, either in Greek system members or students that were not part of the Greek system. Late this week, we were made aware of one fraternity that had, I believe, 16 or so positive members. And then shortly after that, many other students that were affiliated with other fraternities were reported. It's not possible for us to identify how the outbreak started or spread from one house to another. We do know that there were gatherings happening, as I'm sure you're not surprised. Many of those gatherings did not involve students wearing masks. We know that in some of these congregate living settings, folks were not wearing masks inside when they were not in their bedrooms, and that there were mixing at social events. Different groups of students were getting together for different types of reasons and not wearing masks. And all of these risk factors, could have played a role in spreading COVID-19 rapidly through the system, because there is so much ongoing activity and socializing and mixing in this setting. In addition, I think it really points out that even a small number of COVID-19 cases, if introduced into an environment where spread is easy, can rapidly explode into a large outbreak. And in these congregate living settings, again, there's many students in relatively close proximity in a single dwelling, and it's very hard for them to maintain social distance and to adhere to mask use guidance. And we're really trying to emphasize to them going forward that in order to limit future outbreaks, these guidelines are going to have to be taken much more seriously.
Sorry, I was muted. Thank you, Jeff. Looks like we have Natalie Swaby with a question. Natalie, are you unmuted?
Okay, hi, I'm here. Dr. Duchin, I wanted you to possibly talk about the outbreak at Salish Lodge and Resort. Can you give us the latest numbers? Is it still 23 staff and 2 guests? And then also, how and when was public health made aware of the outbreak there? And just talk about the importance of timely notification with these kind of outbreaks as well, please.
Okay, thank you for your question. I may need to get back to you with the timeline. I don't have that handy. We are aware of 24 cases among 80 employees working on the site, and most of the cases have been in the kitchen staff, a smaller number among housekeeping, and then some of the management staff, a small number as well. We know that the first case had symptom onset on the 16th of September, and the most recent case had symptom onset on the 25th of September, and that the lodges suspended their operations through October 9th in order to give people time to recover from their infections and to improve their COVID prevention strategies at the facility. I will need to have someone get back to you about the timeline of our notifications.
Sounds good. Thanks, Dr. Duchin. We do have time for additional questions. If anyone has a follow-up question or a new question, please raise your hand in the chat and we'll get to those. Let's go with Allison Grandy.
Dr. Duchin, with talking about the Salish Lodge, what kind of complications are there when you're looking at the size of that facility and then different facets from culinary to the rooms to the spa?
Yeah, thank you. Our teams are getting used to doing workplace investigations, unfortunately. It's not uncommon for us to have between 50 and 100, workplaces reporting to us about COVID-19 cases each week. So we have both a team of disease investigation specialists, and we have colleagues in our environmental health division, including industrial hygienists. But we do understand how COVID transmits. We do understand what the risk factors are, close contact with others, mask use, poor ventilation, prolonged indoor activities where people are doing things like speaking loudly, singing, or aerobic exercise all increase the risk for virus to be exhaled into the airspace. So when we go out to look at a facility that has so many things that could be happening on site, there's dining, there's recreation, and there's common spaces, and there's also a food service operation. We have to look at all aspects of that facility and to try and identify whether or not there are things that we can recommend to decrease the risk going forward. It's very difficult sometimes to trace backwards, where cases occurred, especially if they're sporadic. We do have a cluster, as I mentioned, in the kitchen staff, and that's something that we've seen in other food service establishments because frequently people who work in the back of house are clustered together close. It's hard for them to separate with the 6 feet of distance. Sometimes it's hard for them to comply with mask use, and they're there for prolonged periods, and in many cases the ventilation is not optimal. So it's not surprising that we identified the majority of cases in that context at the Salish Lodge. But there is, as you are aware of, based on your question, there are a variety of different potential venues in which COVID could be transmitted. And even with this outbreak, it's still a relatively small number of cases to try and pinpoint where individuals were exposed. The other complication is that with many of our workplace investigations, including this one, employees either socialize outside of work or commute to work together and even may live in the same household. So it's not necessarily something that we can assume that all transmission occurred at the workplace. Sometimes there's opportunities for transmission among employees to become infected with COVID-19 outside of the workplace as well, and even though they work in the same setting.
Okay, great. Looks like we have a follow-up question from Nick Popham. Nick, are you unmuted?
Awesome, thank you. So I was curious, we got a press release today about Safeway and Albertsons offering take-home COVID-19 tests. I just kind of wanted to get your thoughts on the take-home tests in general. I believe they're saliva tests that are now offered there, and just sort of the effectiveness of that, if that's a viable option for people, or if you still recommend going to, say, public testing sites.
So that's interesting. I wasn't aware of the take-home tests being offered locally. I'd like to learn more about specifically which tests they're offering. You say it's saliva-based, but I'm not really sure the method that if it's actually a test that the sample is obtained at home and then it's sent to a laboratory where a PCR test is run on the sample, or it's a test that's actually done in the home. And I don't believe there are any licensed tests for people to do in the home. So I don't think shouldn't get the impression that they can do a take-home test and the test is going to give them results in their household. I believe that these tests are where someone may take a sample from themselves and then send it off to a laboratory that then looks for the presence of the virus. And again, the caveats here, I think there's a lot of caveat emptor, buyer beware with these take-home tests and point of care tests at the moment. We don't have a lot of experience with them. And there's a lot of critical dependency on how well the sample is obtained. For example, do people, if it's a swab, insert it into their nostril correctly and keep it in long enough? And then how well the test can pick up COVID-19 in people who may not have symptoms. And depending on the type of method that's used, whether or not a positive result would need to be confirmed or might be a false positive. And clearly, there are implications for people if they test positive but don't have the disease. And that's something we worry about with people who don't have symptoms. And then if people test negative, we don't want them to be falsely reassured that they don't have COVID-19 if the test is not sufficiently sensitive to detect it. So for these take-home tests, I think we're still very much in the learning stage, and I wouldn't I wouldn't depend on it if you're sick. I would see a healthcare provider and get a PCR test in your community. But if you're, using them as sort of an experiment to, if you've got low-grade symptoms, for example, and this is a PCR test that's going to a good laboratory and you get the result quickly, that can help you, quarantine yourself or isolate, I should say, isolate yourself from others and maybe advise others in your contact circle to be tested. But I would feel a little bit, I feel it's a little bit premature to rely on the results of these tests at the moment.
Great, thanks very much. Anna Boyko, Wyrock, you have a follow-up question.
Hi again. Going back to the Greek row outbreak, you said it's not possible to know how it started or spread. Why not? Isn't that what contact tracing is for?
Well, contact tracing is for two reasons. So contact tracing both identifies who has been exposed to a known case. And so the importance there is that people who've been exposed then quarantine themselves and can get tested, and particularly should be tested if they develop symptoms, but it prevents the ongoing spread of infection. That is a key purpose of contact tracing. Contact tracing is also important for helping identify the source of infection and venues for transmission. And in a case like this, of course, with many students infected who have had lots of shared activities and lots of risk factors, it's even though we have people who are telling us what they've done over the past 14 days, it's not always possible to pin down the specific activity that led to their infection. I think everyone needs to remember here that we have a lot of COVID, relatively, a lot of COVID activity in our community right now, and there are lots of places where people can be infected and not know it. Many people, up to 40%, can transmit this disease before they have symptoms, when they're feeling well and when they're appearing well. So you don't necessarily know that you've been in contact with someone who has COVID-19. So when we interview people, we ask them both, do they know they've been in contact with someone, which sometimes happens for household members and others, but we ask them about what they've done in the past 2 weeks that potentially would increase their risk for COVID-19. And then we look for commonalities. And when we find commonalities, sometimes we can triangulate and say, okay, these two people had this in common. This is their only risk factor. and this is where we think they acquire COVID-19. But in the Greek system, we've got a situation where there are students coming in now from around our area and possibly from around the country, many of whom may have been exposed to COVID-19 before they arrived here locally. Students are very active socially and are out and about, and they're undoubtedly experiencing multiple opportunities to encounter this infection, and they're engaging in lots of activities that could facilitate the spread. So, for example, group activities and activities without wearing masks. So when there's so much happening, it's very difficult to tease out the specific transmission venue for any one person. We can say, the types of risk factors that have been relevant, that are relevant, and that are likely to be contributing to this type of outbreak. But for any one person, pinpointing a specific transmission venue can be quite challenging when they've had so many potential exposures.
Thanks, Anna. Allison Grandy, did you have a follow-up question?
I do, please. I wanted to talk about the increased rates over the last couple of weeks. Do you think any of that had to do with more people staying inside due to wildfires and the smoke? And what really is your message for people as we head into fall with more people spending time inside?
Yeah, well, I think there are a couple of potential factors that are driving the increase in rates that we're seeing. And what we're seeing is not unique. Many communities around the country are now seeing spikes in COVID-19 transmission and cases that is becoming very challenging in certain communities. And we want to try and limit the extent of damage that COVID-19 outbreak might cause here by sounding the alarm here today. But multiple factors. So we have the smoke event, which caused more people to spend time indoors. And then we also had a spell of rainy weather, which could have caused more people to spend time indoors. And we've also been hearing from folks about COVID fatigue, where more and more people are just relaxing their COVID prevention practices. And there have been, lots of gatherings, social gatherings, small ones, relatively speaking, among friends, but still large enough to facilitate transmission of the infection. People are doing more traveling in general, and travel poses risks for COVID-19 acquisition. And we're seeing more people getting back to activities like worship in communal settings, which are, sometimes challenging because you're bringing lots of people together in enclosed spaces for a relatively longer amount of time. It's not a brief interaction like you have with a retail purchase, for example. And at times there's singing, which is a high-risk activity. And in addition to that, the ongoing workplace activities and students coming back to school, I think all play a role. I think that, the message to the community at this point is that, we are heading into a time where the risk for a serious COVID-19 outbreak that could be significantly larger than what we've seen so far is real. And that we know what works to limit the spread of COVID-19. Mask wearing whenever we're outside of the home, and in particular, when we're indoors in crowded spaces around others, both mask wearing and distancing are very important. People shouldn't think that if they're in an indoor location and they have the ability to be more than 6 feet apart, they don't need a mask anymore. I mean, we're seeing more and more information from scientists about the potential for this virus to float in the air, and in locations where there's not good ventilation, in locations where there are people crowded together, in locations where people are spending more time together, and in particular where they're doing things like loud talking, singing, or exercising, the risk is increased. So we really want to reemphasize the protection and that people get from masks, and the need to pay attention to ventilation, both natural outdoor air when possible, but also the ventilation systems in buildings and workplaces, that can be enhanced to decrease the risk through either increasing outdoor air intake or increasing filtration. So understanding the importance of masks and the importance of our environments and minimizing the risk in our environments. And also that key element of, not doing activities that really are discretionary to the extent possible. The fewer people we see, the fewer contacts, the shorter the duration of those contacts, the lower the risk. And this virus is going to be able to spread much more readily in the fall and winter. And we're not, in response to that, if we're not going to be become victims, we're going to need to up our game and meet the challenge that the increase in transmission poses by increasing our prevention steps.
Great, thanks very much. We do have a few minutes left. If anyone has any additional questions, go ahead and raise your hand in the chat box and we can take care of that. If not, if we have any closing remarks from Dr. Duchin, we can take care of those. Anna, you snuck another one. Okay, Anna.
Aha.
Yes, go ahead.
Hi. So Jeff, in the past, you've alluded to why public health doesn't publicize every outbreak and mentioned that employers are being cooperative. But what is your responsibility to consumers, to employees of businesses who may unwittingly be walking into places where there is exposure that's still going on?
Yeah, thanks, Anna. A couple of things. First of all, I think based on the level of COVID transmission in our community, everybody should be clear that they're taking a risk for COVID and that COVID may be where they are when they're in public. So there's so much disease out there. So much of it is in people who are asymptomatic. We can't assume that there's no COVID because people look happy and healthy around us. So whenever we're out and about, there is a risk. And that's whether you're at a business or whether you're going to a social event or whether you're going to a house of worship, the potential for transmission is there. And, we know that we don't hear about every transmission event. We know that transmission is occurring, everywhere in our community. And we only hear about certain clusters that, rise up to the ability for someone to recognize and report them to us. So our primary guideline is that when we have information that we think can help the public prevent an ongoing risk that is, unique and identifiable, we try and get information out in a timely way to help mitigate that. One of the challenges we have with COVID, it's a complicated disease to investigate. It takes time for people sometimes to recognize outbreaks. And with small events, which most of our outbreaks, for instance, are potential outbreaks or reports in workplaces, we're talking about very small numbers of cases, 3 to 5 cases where we can't determine the source of the spread. The employees, as I said, frequently have activities outside of the workplace as well. But when we see, a large outbreak and we think the risk of transmission is ongoing and we feel that we have reliable information that the public can use to reduce the risk, that is when we typically will try and do a public announcement in a time frame, that allows people to take steps to protect themselves. Sometimes we hear about things that are too late. But again, when we've got this much disease transmitting in the community, it's impossible to inform people about everywhere where COVID might be spreading. And that's why I think an important rule of thumb for people is to assume COVID is wherever you are and to take personal protective steps and steps to protect others by wearing a mask and keeping distance and limiting the duration of contact and avoiding crowded indoor settings.
Great. Thanks very much, Dr. Duchin. Thanks, Anna. Final question we have time for is from Dana McCall, who writes in, has the entire Salish Spa and Lodge staff been tested and received results now? Have any more guests turned up positive?
Okay, so we may need to have someone follow up with you because there's likely information that I'm not aware of. But my understanding was all the employees had been tested And I don't know that we have all the results yet, however, and that we are not aware of any additional guests that have been positive at this time.
Great. Thanks very much. Any closing remarks?
I don't think so. Well, actually, let me just say, in summary, we are entering a very challenging time, both locally and nationally, with respect to COVID. And I implore people to step back for a minute, to remember what works, and to rededicate themselves to doing everything they can do as individuals and that we can do as a community to minimize the potential for a great degree of illness and suffering this fall and winter. We know what works. We have steps that we can take to prevent transmission, and we can get through this with more or less impact on our community, with fewer or greater number of illnesses, hospitalizations, and deaths. And it's in our power to make it fewer rather than greater if we only take the steps. The type of outbreak that we see coming this fall and the numbers of cases, hospitalizations, and deaths that we experience will be a direct result of the actions we take. And there are actions we can take to minimize that risk. And I hope we're all able to do that.
Great. Thanks very much, Dr. Duchin. Thanks for taking the time today to answer questions. Thanks to everyone for participating. I want to remind you that you can always reach the Public Health Communications team